Once again, a very good morning to all of you. We are happy to welcome you all to this wonderful international webinar. Our topic that we have selected for the day is social work, education, and mental health, changing context, emerging needs, and developing innovative solutions. Will be a wonderful opportunity for us to know about the various dimensions and innovative practices that we have to adopt for the uh, mental health well-being and also how we can practice it through our profession. So dear participants, again I welcome you. We are from many places and from many screens to one screen. So this is amazing and very glad to welcome you all. So before we enter to the session, few guidelines are already given to you, but still I would like to remind you the guidelines. I request you to kindly mute your microphone, switch off your camera. Please avoid unnecessary interference. We all know that we are having a very poor network connection because every people at the moment using the digital medias a lot. So that sometimes that may affect your bandwidth and all. So kindly bear with such kind of problems if anything occurs. And also I request all the participants to use the chat boxes. We have got a chat box in this Google Meet. Use it for shooting your questions and queries so that you will be answered towards the end. We expect it's a kind of interaction, but obviously the interaction is not possible with the direct contact, but we have to make it in the chat box. Kindly bear with that. Then we have got a wonderful speaker for the day. It is none other than Dr. Abraham Francis. Dr. Abraham Francis is an associate professor in social work and human services at James Cook University in Australia. He has worked with many NGOs and corporate sector as a social worker. He has initiated and established many international research projects, supported a number of international field placements, and has been instrumental in establishing international partnerships and research collaborations with universities and organizations in South Asia. He is very passionate about working and researching in strength-based practice in mental health. He has extensively contributed to the literature on social work practice in mental health through his publications, convening conferences, establishing research networks, and by developing consortiums. His other research interests are in the field of communities, criminal justice, international social work, and gerontological social work, etc. His excellence in teaching has likewise been recognized on a number of occasions. For example, in 2010, he was a recipient of James Cook University Inclusive Practice Award for his exceptional support for students with a disability. More recently, in 2016, he received the university's citation for outstanding contributions to student learning for his leadership and expertise in social work education in mental health that inspires and nurtures students to be competent, confident, and compassionate practitioners. More than that, for us, Abraham sir is the man behind the collaboration between the Port Institute of Science and Technology and James Cook University, Australia. A very dynamic, vibrant, um, excellent teacher that we have ever come across in our career as teachers. Dear Dr. Abraham Francis, we, with enough joy, proud, and honor, privilege, we welcome you to this wonderful webinar. Sir, please come forward. The session is yours.
Yeah. All right. Thank you. Can you hear me?
Yes, we can hear you.
All right.
Yeah, perfect.
Yeah. So if you could just upload the presentation, that'll be great.
Sure, sir. Sure.
Sure. Um, Very good morning to all of you. Uh, what a privilege that I have here today to connect with you all through this online platform. I really want to thank Jijo sir for inviting me to this webinar. I also want to acknowledge a number of our colleagues who are present there. Especially, I want to thank the director of DePaul Institute of Science and Technology, Father George, Principal Dr. Unita, the other colleagues from Social Work Department at DePaul, uh, Dr. Anjana, Dr. Vinay, Sharon Miss, um, Dr. Subin, and all others who are joining, the social work team from DePaul. I also want to acknowledge some of my other colleagues who have joined from various parts of country. I can't see many of you here, but I can see some of your names appearing through the chat box. So I just want to acknowledge all my colleagues, friends, and social work academics who have joined this. Also, the students from various colleges, who have joined this particular webinar. I just want to thank you all. I invite you all to join me in this particular conversations, and which in fact, I have titled it as social work education and mental health. And that's a topic that is quite dear to me because that has been an area of my research and practice for some time. And I thought this would be a good way to share with you about some of the changing contexts, how that is actually affecting our mental health. How this particular issue that we're all confronted at the moment is affecting us, and how this emerging needs could be understood, and what are some of the solutions as social workers we could arrive at. And I think that's the reason I have put some of these slides together for you to kind of go through. I mean, in fact, this is an opportunity for us to kind of discuss about what we can do together. And my presentation is uh, in a way giving us some kind of a direction, some ideas around what we can do. I have drawn on from some of the recent literature, some of my own experiences, and share some of these ideas here. So the next slide actually takes us to understand about the context. So my context is always has been in the area of mental health, and my interests have been also in the area of collaboration and working with many various organizations, various mental health groups, support groups, organizations. So my work has been in that particular area. So that's why you'll find in that particular slide where we have talked about the collaboration between JTU and the DePaul. We started this collaboration in 2010, and in fact, this year is the 10th year of our collaborative efforts. So in a way, this is a great occasion for us to connect together while we celebrate our 10th year of this collaborative activities as well. So, as a JPU and DePaul collaboration, we have done a number of activities, and you can see from the next slide where we have kind of celebrated some of the achievements and also jointly organized the conferences. In 2014, we organized a conference on social work practice in mental health. So if you could look at the next slide, that again talks about, Jijo sir, if you could take the next slide, look at the kind of activities that we did in 2014, looking at the mental health context, and we convened a conference on mental health, which really gave us an opportunity to connect with the many stakeholders from India and from other 21 countries. So this is just a kind of a brief explanation about my interest in this area of mental health and how I want to take you through the presentation that I have prepared for you today. I hope you're all well with me. All right. Let's
Sure.
move on to the next slide. Okay, I want you to now reflect with me as we continue to move through the slides. So let me invite you to this particular slide. That I want you to reflect on your own personal experience of COVID-19. That's in the next slide. You know, your own experience in COVID-19, how this has actually affected you as an individual, right? I'm sure many students are actually listening to me as well. So I would like all our students to really take this on board and look at from this perspective how COVID-19 has actually impacted me as a student. For an academic, look at how this has affected my practice. For a social work practitioner, look at how COVID-19 has, in fact, affected my own clinical practice or community development practice or approaches. So look at from that point of view. So personally, professionally, and now look at how this has impacted our family, our neighborhood, our friends, our communities, and look at our state, the state where you come from, maybe from Tamil Nadu, from Delhi, from Uttar Pradesh, Kerala, Karnataka, wherever you are from. Look at how COVID-19 has had an impact on your state, and then let us look at how this has actually had an impact on our country as well, and then internationally as well. So this particular journey, I would like you to undertake with me and to explore how COVID-19 has, in a way, impacted each one of us. I'm sure all of us are affected by it, isn't it? And globally, if you speak, there are pictures and news that appear every day that talks about the kind of issues people are facing. And even in Indian context, we are also, facing a number of key challenges, and one of them being, mental health issues. So just recently, United Nations came up with an executive summary and a report, a policy report on COVID-19 and the need for action for mental health. And that particular executive summary talks about the impact of COVID-19. It says, although COVID-19 crisis is the first, in its first instance, a physical health crisis, it has the seeds of a major mental health crisis if action is not taken. Good mental health is critical to the functioning of society at the best of times. It must be front and center of every country's response and recovery from the COVID-19 pandemic. The mental health and well-being of whole societies have been severely impacted by this crisis and a priority to be addressed urgently. And so this is just a call from the United Nations. And I thought this forms the background of my particular discussion here. So from an Australian context, our Prime Minister talks about stay home, save life, and save livelihood. Now, again, this is also an approach that in Indian context we have adopted, isn't it? So staying at home, how this has actually affected us? Has it in any way affected us? In what ways? And let us examine some of these things. When I was talking to some of my colleagues and friends in India, they said, having this lockdown has actually helped us. We have had some quality time together as family members. We were able to stay together. We had some fantastic time with our children. There was some positive relationships that we could see, in the families. And of course, many of us were able to engage in some creative activities. So the staying at home has had its own positive impacts. However, it also led to some negative impacts. For example, domestic violence, and abuse. And this has been also reported in an Australian media as well, how lockdown has created intimate partner violence, issues around abuse, racism, all those things. But in a way, if you look at the overall picture, you'll see the loss of jobs, inadequate resources, access to care, and new work models. All these things have added more stress in that particular context. And of course, there's also an increased anxiety about, because we don't have control over what's going to happen. So that is very important for us to look at. And if you look at from an Indian context, what I see is that um, the mental health, um, the COVID-19 has been described as a pandemic, but it's also now looked at mental health as a pandemic. So the Professor Shekhar Saxena, who has been um, the director of the Department of Mental Health and Substance Abuse at the WHO from 2010 to 18, he talks about the mental health issues have been poorly addressed, and he talks about the world is focusing on the fight to save itself from the coronavirus. But do you also see a concomitant mental health pandemic in the making? So, as social workers, given that particular context I talked about, this particular question is really, really important for us to think about. And again, looking at the Indian context, one of the recent newspaper cuttings, clips that I have added here, a huge mental health crisis awaits India post-COVID, but only the power of community will help. So that's in the next slide. You know, the huge mental health crisis awaits India post-COVID, but only the power of community will help. And I think as social workers, academics, we take pride in ourselves saying that we work with communities. We engage with the community sector. We interact very frequently with the people across those sections, and therefore it's actually a point for us to think about how can we engage with communities to talk about mental health crisis and what is our role as a profession to work in this context. And the another important thing that I have come across is a specific analysis that is in the next slide, which again talks about managing mental health challenges faced by healthcare workers during COVID-19 pandemic. Now, this has actually appeared in the British British Medical Journal. It's first appeared on the 26th of March, and it actually talks about this pandemic is likely to put healthcare professionals across the world in an unprecedented situation, having to make impossible decisions and work under extreme pressures. So what they're saying is this mental health, um, managing mental health challenges faced by healthcare workers is going to be a big issue. And my question here is, do we have a role to play in that particular context? I'm asking some of these questions because I do not have answer myself. But I'm asking these questions because as academics, as students, we can explore. This analysis is something that is very, very important for us to take into consideration while we address the issue of mental health of frontline health workers. And this is going to be a major issue, even for Indian context. So what they're saying is, why this is an issue? Because our frontline health workers have to work in an extreme difficult situations. They may not have adequate resources. They may not have all the necessary equipments. They may have to take decisions immediately. There may be some ethical issues. There may be some conflicts. So they have to, work in a very extremely difficult context. Maybe with some severely unwell patients with constrained or inadequate resources. Now, all these things can expose our healthcare workers to problems. And that is what they call from this analysis as moral injury. Now, this particular idea of moral injury is something that has appeared in this particular analysis. And I think for us it is important to understand what this moral injury is. It's a term that is used in the military context, but moral injury can be defined as a psychological distress that results from actions or lack of them which violate someone's moral or ethical code. So, moral injury is not a mental illness, but those who develop moral injuries are likely to experience negative thoughts. And if they develop those negative thoughts, then, for example, I'm not a good person, I could have done this, they can develop those negative symptoms. And if that is not properly addressed, then it might lead to major mental health issues like such as depression. And therefore, the symptoms can contribute to the development of mental health difficulties, including depression, post-traumatic stress disorder, or even suicidal ideation. So this analysis, I have left it here for you to look at it. Please read this analysis over 3 or 4 pages. But this actually talks about the moral injury and what needs to happen. There are 4 key suggestions. What they're saying is we need to provide early support. We need to do aftercare. Once the crisis is over, we may need to provide extra care to our healthcare workers. Now, this is actually an opportunity for social work profession. Can we develop some models? Can we develop some strategies in a way that we can respond to the needs of our frontline health workers? So from this analysis, there are 4 key messages. One, healthcare staff are at increased risk. Healthcare managers need to pay particular attention. Proactive steps needs to be taken. Managers must be frank about the situation that staff are likely to face. And of course, once the crisis begins to recede, staff must be actually be monitored. They need to be given support and care. So this particular analysis is important for us as academics to reflect on as how this could be used in our own practice. Now, the next slide is actually going to talk about the changing context. So I gave you a kind of painted a picture about the context, what is happening, and what is this leading us to. The changing context, and I have used the 3 words here: fear, uncertainty, and loss. You might ask, why fear, uncertainty, and hope? In a way, we are all afraid of fear of getting infected. Is that correct? Isn't it? In a way, we are all worried. There's a fear of getting infected, fear of dying. The idea that the illness could strike one's own country or a city or a family. So there is that fear that is there within all of us. The other factor is about the uncertainty. We don't know what's going to happen. We have lost our jobs. Some of our friends and family members have come from Middle East or other parts of the world. They have lost their jobs. We do not know what's going to be there. So uncertainty. And of course the loss. A loss, a financial loss, the loss of human interaction, loss of touch, and even loss of the loved ones in some cases. And I think as academics and students, we can also think about what has been our loss here. We cannot come to our campuses. We cannot meet in person. So there is that disconnection that happens. Many of our habits are, disrupted. There's a persistent feeling of something missing. We are missing something in our life. Is that a sense? We all feel, there's something that is missing. I'm not able to go to my college. I'm not able to meet my friends. I can't get my wonderful coffee that I'm used to buy from every day. I'm missing something. And I'm also talking from my own personal experience of being in Australia. I'm actually talking to you from my home. I can't go to my office. So there is a sense of fear, there is a sense of uncertainty, and there is a sense of loss. Now, this leads to us, that psychological impact. So this is creating a psychological impact in us, in all of us. A feeling of loss, a feeling of hopelessness, a feeling of helplessness, isn't it? And a normal function is getting affected. And that's why we need to think about and ask this question: is my normal function getting affected? Am I making myself clear to you, did you, sir?
Yes. It's clear, sir. It's clear.
So what is happening here is, from a very mentally healthy people, that we are moving into needing some kind of interventions. So ask yourself this question: Am I functioning okay? Check with your friends, check with your colleagues, check with your family. Are we okay? Are you okay? Is there a way we can help you? And checking in is an important aspect. Especially, I request all my colleagues in the academia to ask your students simple question: Are you okay? How are you traveling? Do you need any help? Simple questions that are such as this way is going to create an engagement with your student cohort. The students, please ask this question to your community members. Are we okay? Is there any struggle here? How are we going? Is there any support that we need? Ask simple questions. Now, the next slide is again in the same direction, that the changing context are, in a way, all of us are getting affected. Uncertainty. No, the same points that I mentioned, suitability of stability of our income is affected, and economically unstable, unsustainable. How long can we continue to live in this kind of a situation? Look at the ordinary families. They may have had some bank balance with which they have managed for 1 or 2 months. What next if they can't go on to have employment? So, is it economically sustainable? And also ask this question: medically, is it sustainable? Our medical professionals, frontline workers have been working very hard, isn't it? Around the country, around the world. And is it sustainable? How we can support them? So that's again another question. And of course, I want you to add your own, addition to the list that I mentioned. So in a way, what I'm trying to say is the context is changing. I hope you all agree. The context is changing. Context is changing rapidly as we speak. As we speak, from a regional perspective, from a state perspective, from a country's perspective, things are changing. Keep an eye on what is happening to your own communities, your own networks, your own families, and to your own self. Ask that question. Now, what is the impact then? That's in the next slide. What is the impact? The impact is huge. It's very difficult to comprehend at the moment. What we know is that we are living through this situation, isn't it? This is the current environment we're all in, and trying to do what we can. And I want to appreciate to all of you that as social workers and academics and students and practitioners, we're all doing in whatever way we can to reach out. I've been part of some of the conversations in India, so I'm aware of the kind of work social workers are doing. So congratulations, good on you, students, good on you, my friends, for reaching out to communities, because that is the need of the hour that we are trying to support. Of course, protecting ourselves, looking after ourselves, yet wanting to support our communities. And in fact, this has created a global health crisis that has had a deep impact on the way we perceive our world and our everyday life. Now, so this leads to my next argument here. This is our Indian context, we need to see the bigger picture. What is the bigger picture? Next one. So the next slide is the bigger picture. The bigger picture is we need substantial investment needed to avert mental health crisis. We need substantial investment. And I think we need to advocate as social workers to get more funding, more resources allocated to manage this mental health pandemic in our communities. So this leads me to ask the next question. What are some of the emerging needs? What are the emerging needs? I want you to write. I want you to use the chat box and start writing. What do you think are the emerging needs? If this is the context, that I have painted for you, there are issues, there are problems, but what are the emerging needs? Probably you could start writing your own comments. So you're actually engaging with me in that thought process. So my immediate response here is the safety, well-being of people, the economic stability, the medical facilities are being made available, access to resources, access to food, the basic needs. While this is these things are made available, but I think we need to see this as an emerging need as well. Okay, so my next slide is again, I hope you're all writing your responses in your notebook or through your chat box. Of course, what is needed and what is available. What is needed is this. My wish list is this much, but what I have at the moment is, I need 100 rupees, but I only have 5 rupees at the moment, isn't it? So, in the context of mental health, what is needed is not is what is available, and that's a remark made by Professor Shekhar Saxena as well. So you can look at that website. And for me, again, the other point is about the at-risk population. That's the next slide. Around 150 million people. If you go to the next slide, yes, at-risk population include 150 million with the pre-existing mental health issues. The frontline medical workers, young people, differently abled people, women workers in the unorganized sector, and the elderly. Now, I have used some of these slides and examples drawing on from what is currently available in the media. So just to bring these points across. So I've used some of these examples here. Now, of course, we have heard about the issues of our migrant laborers, the mass exodus. The people have been moving from states to states, and how that has caused big challenges for states and authorities and people themselves. So look at that as the vulnerable sections of the people, of the community. As social workers, we say we work with people who are vulnerable, people who are really dislocated, people who are needing our help. And so in this context, there are many millions of people who are being affected by COVID-19, and slowly they're also experiencing that mental health distress. And it is in this context, I want to say, we don't need to kind of label everybody as saying that they are people with mental illness. But there are different ways that we can approach this context. We don't want to name the entire cohort of people saying, oh, they're all now people mentally ill. But I think we need to adopt a different strategy. It is in that context, let me remind you of the WHO recommendations that just came last month. If you go to the next slide. The WHO recommendations. Yeah, what else? I think that's my next part. What are the solutions? So, as part of the solution, I see here the recommendation. There are 3 recommendations from the WHO. It came out in 2020, just a couple of weeks ago. 3 important factors. 1, apply a whole of society approach to promote, protect, and care for mental health. Ensure. So the first one is about that, and I want to kind of touch on that. He says everything needs to be done to protect people from pandemic-related adversities that are known to harm mental health. So that's the first thing. And in the second one, the community action that strengthens social cohesion, solidarity, and health coping reduces loneliness and promotes psychosocial well-being should be supported. That's the second point. And in the third one, the direction says support recovery from COVID-19. Now, mental health requires much larger overall investment. And I think Professor Shekhar Saxena also talked about we need larger investment. And what is happening is the direction from the WHO here, I think just a correction here, it's not WHO, it's a United Nations document. It talks about a larger part of the term plan to improve the quality and reach and the cost effectiveness of mental health services. It is recommended to shift investments away from institutionalization to affordable quality mental health care in the community. That's a big shift, isn't it? A shift from the institutional to community mental health. And I'm thinking here there is an opportunity for us. Here there is an opportunity for social workers to develop programs and approaches that might support our communities. So let's go to the next slide. In this context, because it's about community, how we can work with communities. And I think here it's about this particular question, asset-based community development. What internal resources we have been able to use during these difficult times? It's a question to all my students, all my colleagues here. What are the internal resources that we have been able to use rather than focusing on what we have lost in the process? So let's shift our focus back onto the strengths of the community, because all those three directives from the UN is aimed at developing capacities within the community. Now, I'm mindful of the time and uh, the time that is allocated to me, but I wanted to share the important work done by Professor Vikram Patel. That's the next slide. I'm not able to show that video here, but in your own time, please watch this particular video from Professor Vikram Patel, who talks about mental health for all by involving all. And I think this particular video will actually help you to understand the concept of the community work that I have been talking about. Again, the directions coming from international organizations as well. So as community workers, social workers, I think here there is an opportunity for us. Do you see what I'm trying to say? Yeah, here there is an opportunity. Now, the next slide is again some of the work that I have been doing about mental health literacy. So a couple of my colleagues, Dr. John Ashfield, Dr. John McDonald, and Anthony Smith, we tried to look at the mental health literacy. And we wrote a paper, again, which is available here. We want to look at the mental health literacy. And I think this is the time we need to revisit some of those ideas presented by Professor Vikram Patel, and also some ideas from this paper about developing a situational approach in the current context, what we can do. And this situational approach here means, the next slide, is an approach to mental health represents a significant departure from the current medical framework and its emphasis on illness and the use of illness language relating to mental health. It reconceptualizes a broad spectrum of human distress as non-illness and remediable largely with non-medical intervention. So as I said earlier, we don't want to name everyone with a label that people have got this illness, but we can reconceptualize that and use non-medical intervention to support our communities who are actually doing it tough at the moment, who are really facing some of the challenges that I mentioned earlier, isn't it? Do we need to call all of them as people with mental illness? No. Probably we have to provide them with some ongoing support, some design some new ways of engaging with them so that they can be supported. And of course, if they need a medical intervention, of course, we need to provide them with the medical intervention. But here, my point is how this mental health literacy is being looked at. And if universities and colleges can look at mental health literacy as a component, I think that would be a great way to kind of preparing our students as community leaders, like that. All right, so that leads me to the next slide, where the importance of building community, the importance of the situational approach, and emphasizes the vital importance of building capacity for taking a primary role in promotion, prevention, and intervention. It is a huge role for us. Now, let me take you to the next slide, which would be something beautiful. Again, it's written by Professor Vikram Patel. The next slide is about a wonderful word which we all use in our Hindi language, sundar. Sundar means beautiful, isn't it? And Professor has used this word in a way that, yes, stands for simplify the message. Simplify the message. And it is in that context I want to talk about three important things. I think our role here is to demystify. As social workers, we need to demystify about this mental health jargons and the terms. Demystify, depoliticize, and destigmatize. So we need to simplify the message. We need to unpack the interventions. We need to deliver those services where where it is possible, near to the communities, and we should recruit and train available human resources as local communities members. And then finally, we should judicially reallocate the scarce and expensive resources of mental health professionals to design and oversee mental health programs. So the point that I'm trying to drive here is there are a couple of examples, couple of ideas that we can draw on to work in our community settings. As social workers, we can design new programs. We can come up with new ideas to work with our communities who are doing it tough. And some of these ideas are already there. You may have to just need to go back to some of this literature, look at the evidence, and then develop indigenous literature, develop materials or develop information or programs that are locally suitable so that that becomes more relevant for the community sector. So now this leads me to the next question about social work education. Let's talk about social work education. The question is, will it be the same? There is still debate going on. It will still be the same. I don't have an answer. I'm just throwing it open here. Should it be the same? What needs to happen? How can we make this happen? And of course, some of these questions associated with what are the challenges before us. Now, the next slide is again, the paradigm shift which I'm talking about. We have been using a lot of online education, Zoom meetings. I know my colleague from Bipor, Subin sir, has been using a lot of online technology to kind of talk to his students, other colleagues as well. I'm just using one example. So Zoom and Zoom out experience. Some of my students say, Abraham, we are zoomed out. We have had enough of Zoom meetings, so that's another thing. Relevance of concept, what has worked and what hasn't worked. Again, the question is, are we frontline workers? Are we preparing our students to be frontline workers? In a way, this has given us this international global connectedness. We are able to connect with you. There are a lot of positives as technology has facilitated this invisible relationship. All those things are there. Now, next one is about going beyond the contemporary social work. I mean, the US has come up with the US social work educational programs across the country quickly shifted to online. Even in Australia, the Australian Association of Social Workers came in and supported the higher education provider to move into an online education system. So the point here is, the impact the COVID-19 crisis has and will continue to, the impact that the COVID-19 crisis has and will continue to have on social work cannot be overstated. So in this context, my question, a couple of questions in my next slide, only questions. What are some of those questions? What needs to happen in mental health sector? Do we have sufficient trained manpower? We are talking about 1.50 million people, isn't it? Do we have enough trained manpower? What we could do as social workers? What can we do as educators, institutions of higher learning? Again, I don't have answers, only questions. But my next question would give you an answer. What is the next slide? The next slide is just being, just using the critical social work approach, right? Just being using that critical approach, because it's about social justice and human rights. But I think using that critical lens, right? And that critical lens leads to something else. What is it? Next one, sir. The critical lens leads us to simply look at this, be curious. Remember to look up at the stars and not down at your feet. Try to make sense of what you see and wonder about what makes the universe exist. Be curious, and however difficult life may seem, there is always something you can do and succeed in. It matters that you don't just give up. Just don't give up. The difficult situations are there. We are all going through this, but just don't give up. And that leads to me to talk about, what should be our approach be? I think our approach should be about, developing creative ways to move forward. We need to be ethical. We need to be responsible, and at the same time, we need to be rational because the future is unknown. We don't know what's going to happen. But in our attempt, we need to be rational. We don't want to take decisions which are, emotionally driven. We need to be rational in our approach. Embrace technology as necessary to, social work if it is required. We cannot replace our fieldwork experiences. We need that human interaction. We need those community experiences. But we may have to change the way we have been operating. Business is as usual is the term we always use, but it is not going to be that way. It is not going to be as usual. We need to look at, anticipate what is yet to come. What is yet to come. Even in Australian context, we are looking the current context as, yes, we are now going through the situation. Let there be no second waves. That is what we are talking about here. In a Kerala context or in an Indian context, anticipate what is yet to come. We don't know, isn't it? And that is again going to escalate that feeling of anxiety for people in terms of their stability, the economic, the financial freedom people experience, the social connections that people experience, and of course, here the idea of pandemic versus possibility. Of course, we see this as a pandemic, but we also see this as an opportunity, possibility. And I gave you some of the ideas here as possibilities for you to look at. And that leads me to, the next question, that while we do all these things, so our students are working, our colleagues are working, I think all the more we need supervision, we need support, we need guidance, we need direction. And for students, it is important that they are supported. Their well-being is taken care of. The safety of our students are, taken care of. And that the risk factors to be assessed. And so therefore, supervision needs to be really looked into. And therefore, what are my recommendations here? My recommendations are, we need to revisit the pedagogical approach to teaching. That is not the next slide. Revisit the pedagogical approach to teaching. And ask this question, are we really relevant in responding to the needs? Do we need more skills? I think we also need to develop indigenous strategies to address social issues. A strong emphasis on developing authentic e-assessments and feedback mechanisms. Authentic assessments and strong emphasis on social work and mental health education. And looking at the curriculum, how do we incorporate mental health of students in the higher education sector? How do we include mindfulness, yoga, some of the Indian ways of managing stress, all those things in our curriculum. I think introduce self-care strategy, a very important idea to look at how do we incorporate self-care strategy as a curriculum, or especially in the curriculum. Again, approach research with sensitivity and ethical framework, and of course it needs to be approved by the universities. Here there is an opportunity for us to promote interdisciplinary education and more content about public health management, public health systems. So that way we can work, nurses and social workers can work together. Police and social workers can work together. So that, interprofessional education and ideas needs to be included in the curriculum, and especially with the mental health curriculum, I think there is a need for us to develop locally developed ideas, especially the one that Professor Vikram Patel talked about, the Sundar idea, how we can simplify the messages, how we can use the multimedia to develop messages which can be easily sent to our communities. So we can demystify, we can destigmatize, and then we can depoliticize, because everyone is affected. So that is my kind of a recommendation here, and my main message here before I finish is I have no special talents here. I say I'm just only passionately curious, and the idea of just talking to you is just because out of my curiosity to interact with you. the curiosity to know what is happening there, and also this allowed me to actually explore some of the current things in mental health, and allowed me to kind of share some of those facts with you. And my last slide is something which I thought you would be interested in knowing about. Yeah, demonstrating the professional identity, and that there is a move, there's an interest from social workers to talk about our profession, visibility of our profession, which I think our students and colleagues are already doing. And if you are actually doing some activities during this time, please document it, please share, and that way we are able to showcase as what social workers are doing. And as before I conclude, the last slide, which is historically, as Arundhati Roy says, and she reminds us, historically, pandemics have forced humans to break with the past and imagine their world anew. This one is no different. It is a portal. Sir, it's the next slide, sir. Um, it is a portal, a gateway between one world and the next. We can choose to walk through it, dragging our own carcasses to our prejudice and hatred, our avarice, our data banks and dead ideas, our dead rivers and smoky skies behind us. Or we can walk through lightly with a little luggage, ready to imagine another world and ready to fight for it. And my dear friends and colleagues and students, this pandemic has caused one of the largest paradigm shifts in social work education, research and practice in history. And we must adapt in ways that align with the social work values. We can embrace it. There is a possibility here, and we should be ready to fight for it. And thank you so much for listening to me. Thank you for giving me this opportunity to share some of my thoughts with you. Thank you. Bye for now. Any questions?
So if you have got any questions, please use the chat box. So I will be active in the chat box and I will explain the doubts. Any doubts, please? Hello, any questions, please? Participants.
Abraham sir, there is a question. How can we overcome the personal emotions? I hope you can see in the chat box.
Yeah.
This is asked in case. Yeah.
Yeah. Thank you for that question. In social work education and in our professional practice, we talk about the self. The self. We talk about. It's an important concept. Know yourself. And because we don't have any other tools, like doctors, we don't have stethoscopes. Like mechanics, we don't have, the spanners or any other thing. We don't have any other tools. As social workers, we only have ourselves. And therefore, that question is really valid, because we all have emotions. And how do we process that emotions? And how do I respond to those emotions? And I think we also need to understand the context in which those emotions occur. I think the question, that particular question, may be in relation to. I do not completely understand the context, but I assume that the emotions, when you actually start working as a frontline health worker, you are witnessing so much, so many difficult instances. You're exposed to harsh realities. Now that can be a source of emotional distress. Now, how do you manage that? That may be the question. how do you manage that? I think first is that you are able to recognize, yes, I am really feeling it. First is to recognize that I'm actually undergoing some emotional disturbance here. And the second one is, as I mentioned, supervision, professional supervision. Take those issues into professional supervision. Talk to your supervisor about how I have been managing. This is actually challenging me. And very important for the social work student and practitioners to take this into supervision. And that way you can develop some strategies. So you can develop personal strategies, some professional strategies, so that you are not breaching confidentiality. You are not, going against any ethical codes. You're true to your profession. You abide by the principles of and codes of and the values of the social work. So being mindful of the emotion, taking that into supervision, developing some of your strategies, and ask yourself what has worked for you in the past when similar things have happened to you. So you can use those experiences as you move forward. Yeah, thank you.
So one question asked from a YouTube participant.
Yeah.
Can you please explain about the critical social work approach?
Critical social work approach. Yeah. I think there is a full textbook on that. But simply I ask this question. We need to ask ourselves this question. Why I do the way I do? Why? Why I'm doing this way? What is the science? Is this actually causing harm? The work that I do, is it causing harm? Is it socially just? Is there a violation here? Am I able to support people? So asking those questions are very important. It's just in a way you're actually checking your blind spot. Did I do the way I was supposed to be doing it? Did I do anything rightly? So ask. So what did I do? How I did it? Whether there is a room for me to improve? How I can, change my practice in the next. I think there are a number of examples and literature around this particular aspects, critical social work. Yeah.
Any questions more to be clarified?
Yeah. So there is another question asked by Father Joseph.
Yeah.
He said, now we are asked to live along with Corona COVID-19. So how can we live along with Corona by maintaining the mental health?
Yeah. Thank you. That's a very interesting and thought-provoking question that one must ask. I am, and you're living alone. You are asked to live. So if you're living as a person in your own house, or if you're living as a family, different ideas you can use. The first thing is developing a routine, because one of the ways the imbalances can happen is when you don't maintain a routine.
True,
And
true.
it's developing a sense of purpose. So developing a routine, developing a sense of purpose, and something to do, and develop an activity, something to do, something to love, and something to look forward to, and we have to create that.
Exactly.
Yeah. So if you don't have any immediate connections, maybe use technology to connect with some people. Use this time creatively to come up with some new things. So creativity is is something that I think you can use at this time. Maybe learn a new skill. Probably some of the students, I was talking to a group of students, and they said, "Oh, we don't know what to do." I said, "Learn a new skill. I don't know how to do video editing." So I suggested, why don't you take up video editing as a skill to be learned during this time? So take it very personally in terms of how am I going to manage myself? What is my emotions? How do I process my emotions? How am I getting connected with my friends and colleagues? What is the purpose that I have now? What strategies can I make to upskill during this time? And how I can keep my motivations? So by asking some of these questions, you will find some answers. And also developing an online support group. So if you think, Father, that is the question that you asked, if you think that is an area where people are getting disconnected, probably you can actually start doing an online support group program to mentor, support people so that they are not left alone. So that's another strategy that you could actually start. Just an example.
Okay, sir.
Yep.
One more question from Vinay Sharma, who is also
Yep.
participating to the YouTube live stream. He's asking, how can we deal with the uncertainty of future as a social work practitioner? Is uncertainty of jobs in future? How can we ensure our career growth in getting jobs?
Yeah. It's a very difficult question to answer, isn't it? Uncertainty. But my response has been one step at a time. One step at a time. And be in the moment. Be in the moment, because we are trying to live in the future,
And be updated.
isn't it? And I think that is going to cause more distress. So my simple strategy here is just be here and experience the now. And of course, we may have to look at developing some strategies as things evolve. There is no straightforward answers, but I think we have to be. I think I used three words. We need to be rational in our approach. We need to be thinking about, but not taking any decisions because we are emotionally charged. So one, take a step back, stop for a while and see what is my current situation, assess it, and then think about the future. But don't live in the future now.
Another question, shall I ask you?
Yep.
From Asha, she has asked this question. How can you connect the critical social work with indigenous method of treatment?
Sorry, I didn't get that. Can you just
How can you connect critical social work with indigenous method of treatment? So she is asking about the indigenous methods or the alternative systems of new medical treatment with the critical social work approach. How can we relate it?
the fundamental question is: are you causing any harm to people? Whether you're using this method or that method, are you causing harm to people? Is it helping people? That is our fundamental effort, isn't it? What is our profession stands for? We work with the vulnerable group. We aim to promote social justice and human rights. We aim for the betterment, isn't it? That's the mandate of the profession. And in that process, are we causing harm? Are there risks by taking up such activities? And by asking that critical questions, you will be able to find an answer.
Good. So two more questions.
Yeah,
Shall I ask you?
yeah, yeah.
Yeah. From Sangeeta Anthony, she asks, could you elaborate on status of social work education during COVID-19 in Australia? Would you elaborate on status of social work education during COVID-19 in Australia? That's a question from Sangeeta.
Sangeeta, how many hours do I have? Of course, I can briefly share with you the social work education in Australia is continuing, but I can talk about from my university. We had to call up our social work field placements. So our students were not allowed to go to field placements. However, there was no face-to-face field education, but they were sent and given opportunities to undertake online placement, which we call it as e-placements. And we also have kind of shifted the entire face-to-face teaching to an online environment. And we have some good systems here through which we are able to connect with our students. We have Blackboard, we have collaborative sessions, we have online lectures, and then we have tutorial groups through groups. So there is a lot of technological advancements, and our students do engage. through those processes, and we have just finished our first semester, and it went well, and we hope this will continue even in our next semester as well. So we have gone on the full time, online, but the accrediting team, which is Australian Association of Social Work, there is a requirement for the higher education providers to provide some face-to-face component, which is 20 days for the master's program, and therefore we have to come up with some strategies as we get out of this COVID-19 situation, so that we can comply with those kind of requirements. So at the moment, yes, everything is going well.
Great.
Of course, there is that issue here.
So one more last question.
Yep.
Okay. As you said, incorporating self-care strategies in curriculum is important. So can you explain some strategies for work-life balance? This is a question from Mary Sheetal. Should I repeat the question, sir?
Yeah.
As you said, incorporating self-care strategies in curriculum is important. So can you explain some strategies for work-life balance?
Right. So self-care is important, whether you're a social worker, you're a management professional, you're a health professional. I think this is a very important aspect, and very often we get, we don't do it. We forget because we don't find time. So the first thing is personally taking a decision to incorporate self-care strategies in our personal life. Now that can happen through saying, I'm going to devote 1 hour every day doing a meditation session, or maybe listening to some wonderful music, or going for a walk, or something like that. So you're actually using some of that time for your own personal care. Self-care is very important, and when you take that particular self-care approach to your own workplace, you could have a collaborative session on, you could have a mindfulness session. So what we do, what we did this semester, while our colleagues were all working from homes, one of the things that as academics we did was, one of my colleagues, she's a trainer in yoga. So, she actually connected us through online platform on a particular time of the day. So 11:30 in the morning for 15 minutes for a yoga session. And all of us used to come wherever we are. We will just, stand there and we will do some yoga sessions. So I think choosing some time and consciously selecting some activities so that could become part and parcel of our life. And so this should not be just seen as an add-on, but I think this should become part of who we are. And as professionals, this becomes more important because we are going to, see difficult situations. We are going to interact with all negative aspects. We are going to meet with problems, challenges, and how are we going to take it up? Because we don't have any other tools. We only have ourselves. We need to really look after ourselves. Right?
I think
And of course, yeah.
Okay,
Yeah.
continue, sir.
No, that's fine. Thank you.
Okay, one more question, sir. So that is relatively your area, I think. I think if I don't ask, that will be a problem. So that's a question from George Anthony. Is there any relation between reflective learning and critical social work practice? A question from George Anthony.
Yes, of course. Reflection, of course, there are two elements here. Again, your reflection is, based on your experience. Your reflection is based on your experience. What has been my experience? How did I do it? What way I did approach my client today? What was my response to my client today? And my responses were appropriate? Could I have done it differently? And all those questions are your own personal reflections. But from a critical point of view, you're beginning to challenge the power relations, the power dynamics. Who is in control? Who is making the decisions? Do I have access to resources? Who controls everything? and those kind of reflections are going to be more reflective in nature, but at the same that's going to be critical. So if you're employed in an organization where as a social worker you are employed, but you don't have any specific role clarification or descriptions given to you, but you are just asked to do some work, then you may start to critically think about, what am I doing here as a social worker? My mandate here is to work with people who are marginalized, people who are from a vulnerable population. People need to be supported. But am I really doing that work, or am I doing something else? So those elements needs to be looked at from the power, privilege, and positions. Right? 3 points: power, privilege, and positions, and challenge the assumptions. I mean, it's a big lecture. I need more time to expand, but yeah.
So that was fabulous. I think the registered candidates are signing off